Öncelikle asistanlık eğitimimizi tamamlıyoruz. 4 yıllık asistanlık eğitimi.
First, they are taking assistantship and it takes 4 years.
Sonrasında devlet görevimiz oluyor. 2 yıllık bir devlet görevi.
Then they have state responsible work. It takes 2 years.
Bunun sonrasında ben bir üniversite hastanesine başladım. Bundan sonraki aşamada İstanbul'da bir üniversite hastanesine başladım.
After the governmental hospital, our doctor started in university hospital.
Burada yapmamız gereken belli eğitimler var. Hem öğrenci eğitimlerine katılıyoruz, hem asistan eğitimlerine, hem de kendi çalışmalarımızı gerçekleştiriyoruz.
In this case, there is general education, then they have assistant education, and now there are some works that they are doing themselves. For example, they are writing articles upon some interesting cases.
So they're teaching and working at the university hospital for 4 years?
4 years it's assistantship.
Okay. This is the total time of teaching and working.
Onun belli bir süresi yok ama ben üniversitede 4 yıl geçirdim toplamda. Sonrasındaki eğitimde yani.
There is the first education is 6 years, and then for assistantship it takes 4 years.
Correct. After 2 years of working
After
for the
that,
state hospital.
Yes.
Yes.
After that, doctors can take some different educations, but it depends on their wishes. For example, some doctors want to have like narrow specialization. In this case, they are just taking for 2 years educations.
After 2 years, I worked in Foundation University in Istanbul for 4 years as assistant professor. I perform surgeries and also perform articles and student educations. Bu sürede belli yayınlar yapmamız gerekiyor. Bu yayınların hem yurt dışında çok iyi dergilerde yayınlanması gerekiyor, hem de yurt içi dergilerde yayınlanacak yayınlar yapmamız gerekiyor.
During this period, doctors must give publications that will be published not only in Turkey but also internationally.
Bunun dışında kitap bölümleri yazmamız gerekiyor.
Next to this, doctors also must write parts for book.
And this book is for the ministry, or this book is for the hospital?
It's education books.
Educational books.
Okay.
About gynecology.
Okay, so that the educational books are modern. They're always
Yes.
changing to current
Yes.
current experience.
Yes.
Okay.
And they are supported by cases or
Right.
yes.
Bunun dışında dersler vermek gerekiyor dedik. Akademik toplantılarda, kongrelerde yaptığımız çalışmaları sunmamız gerekiyor.
Next to this, these publications are also presented not only at the universities but also on congress, or there can be
International congress,
academic academic presentations also.
Yes.
Okay.
Bunlarla beraber belli bir puan ortalaması yakalıyoruz ve doçentlik için başvuru yapma şansı elde ediyoruz. Bunun için de jüri atanıyor. O jürinin değerlendirmesi sonrasında bizim doçentliğimiz onaylanıyor.
These publications, they are giving, they are past evaluation and they are giving you grades, and you're collecting these grades. When you collect needed grades, then you can apply to associate prof and then prof.
Merit. This is it's a merit system, I believe. I think it's called a merit award. So a recognition for what you did is a necessary thing. It's a new thing. When you have your merit award system, I believe, is to where it needs to be. You can move forward.
But let me tell you one thing. There are a lot of doctors who can have a lot of experience, but they are not publishing it, and they're staying like they can stay like specialists, they can stay associate prof. They, if they publish, they will easily gain associate prof and prof. That's why when in Turkey we say associate prof or specialist, just you need to check their experience. When they have really good experience, they have a lot of patients, and sometimes you just cannot book appointment. So let me tell you about Dr. Taha. Dr. Taha also has a big experience. He will use this experience in publications. He will use this to get the professor degree. But we need again to look for the experiences.
Şu mesela bu dergi Japon Obstetri Jinekoloji Derneği'nin
It's
dergisi.
a Japanese journal for obstetrics and gynecology research.
Bu 2021-2022 yılında o dergide en çok atıf alan yayınımız olmuş bu yıl
These are
mesela.
top articles in 2021 and 2022.
Instagram sayfamda
So you
paylaşmıştım.
can see that
It says recognized as a top-cited paper.
Yes. Hani yaptığımız yayınların hem yurt içinde hem de yurt dışında değer görmesi gerekiyor.
These publications, they must gain value in Turkish and international journals. I mean, those publications have significant interest to medicine, like World of the As.
Yeah.
So.
Hızlıca isterseniz yaptığım ameliyatlardan sunum üzerinden de bahsedeyim. I want to explain with this presentation my surgeries. And mostly I perform endoscopic surgeries. The kind of endoscopic surgeries are laparoscopy and hysteroscopy.
These are minimal invasive surgeries.
Surgeries.
There will be only little holes, so when these performed, there will be no big scars. There won't be like
we perform the surgery with these small incisions.
Yeah.
These are open operations, and this is small incisions.
This is an example of minimally invasive.
Yes.
Even the robotic surgery is done laparoscopically. It's like with
robotic surgeries and laparoscopic surgery incisions are similar. We perform these surgeries with minimally invasive procedure. This is open surgery. This is laparoscopic surgery. This is after the first day of the surgery. And after first month, there is no incision, there is no scar, and hospital stay is decreased and less, and also the pain and the bleeding is less.
Rehabilitation period is also shorter.
Less trauma to the body.
Yes.
We perform this surgery, diagnosis and also treatment, and mostly infertility. This is leiomyoma, and leiomyomas are the benign mass of the uterus. It may lead pain or abnormal bleeding or infertility.
This is the most popular thing in woman body. I mean, I guess every woman has it. It can be like early or in older ages.
Approximately 60% of women have leiomyomas. Some of them lead some problems, and we should perform surgery. This is one of my surgery. We took approximately 20 myomas from the uterus. We preserve the uterus and the fertility. Just take the myomas. This is ovarian mass. This patient is 11 years old, I guess. And there's 10 centimeter mass, dermoid cysts. We perform laparoscopic surgery, and we also preserve uterus and ovaries in this process. And endometriosis, other most popular gynecologic problem. Some kind of endometriosis, we have to perform surgery. Some kind of endometriosis, we give medical therapy or infertility treatments. But in deep endometriosis and pain, we have to perform surgery. The laparoscopic surgery is the best treatment method for this problem. And also I perform hysterectomy for the patients with abnormal bleeding and leiomyomas and elder ages patients. We can perform hysterectomy. And another most popular problem is genital prolapsus. There's 3 kind of prolapsus: the uterine and bladder and also bowels. We can perform these surgeries with laparoscopy, laparoscopic methods. And this is the image of the sacrocolpopexy procedure. We use this mesh. We take the prolapsed materials. Burada sarkan yapıları alıp kuyruk sokumu kemiğine asıyoruz mesh aracılığıyla. Bu ameliyatta temel olarak yaptığımız şey bu.
This mesh helps to gather what is loosey.
Yeah, uterine or vagina to the
to allow
sacrum.
it to heal.
Yeah, to the sacrum bone.
Yeah.
No, it like gathers.
Okay. Once it ruptures.
Yeah.
Not ruptures, but it's like losing. Like
Is this permanent?
Yes.
No, it's permanent. But some women, when they give birth,
Yaşa bağlı olarak, doğumlara bağlı olarak veyahut da kabızlık, kronik öksürüğe bağlı olarak.
there can be different reasons for having saggy or loosey inner organ. So it can be giving birth. It can be in older ages, and also it can be constipation problems. By this mesh, the looseness is gathered.
Striker 4K.
It makes
Teşekkür ederim. 30 derece.
uterus more tougher. It collects.
And the other problem is urinary incontinence. Sometimes types of urinary incontinence, we give medical therapy, but some type of urinary incontinence we have to perform surgeries.
Can I ask you about this?
Yeah.